Now, a new variant of coronavirus has been identified in the United Kingdom. According to the British Health Secretary Matt Hancock, at least 60 different local authorities in England have recorded COVID infections caused by this new variant. The World Health Organization has been notified and detailed studies are already being conducted.
We've currently identified over 1,000 cases with this variant, predominantly in the south of England, although cases have been identified in nearly 60 different local authority areas, and numbers are increasing rapidly. Similar variants have been identified in other countries over the last few months. We've notified the World Health Organization about this new variant, and Public Health England is working hard to continue its expert analysis at Porton Down. Mr. Speaker, I must stress at this point that there is currently nothing to suggest that this variant is more likely to cause serious disease, and the latest clinical advice is that it's highly unlikely that this mutation would fail to respond to a vaccine.
Matt Hancock also added that there was nothing to suggest if it worsened the disease or if the vaccines would no longer work. Meanwhile, the World Health Organization has said that it is aware of the new variant of the virus that has emerged in Britain, but the WHO's top emergencies expert Mike Ryan added that there's no evidence that the strain behaves differently to existing types of the virus.
We are aware of this genetic variant, I think reported in about 1,000 individuals in England, and the authorities in the UK and under Matt Hancock's leadership obviously are looking at the significance of this. We've seen many variants, as we've always said here. This virus evolves and changes over time, and we've seen different variants emerge. The question is, what is their significance in public health terms? Certainly looking at this particular variant seems to have become more prevalent in the UK. We'll obviously need to work with our international lab network to see if that variant is becoming more prevalent on an international basis.
The UK government has also placed London and surrounding areas under the highest level of coronavirus restrictions. Under Tier 3 restrictions, the toughest level in England's three-tier system, people cannot socialise indoors, and bars, pubs and restaurants must close except for takeout. UK has recorded a sharp increase in the number of infections and exponential rise in the virus cases across London, Kent, parts of Essex and Hertfordshire have also been recorded. Let's quickly go across to our London Bureau Chief Mandy Clark, who's joining us with more details. Mandy, will the new strain of coronavirus impact testing and the clinical outcome in any form or way?
Not that we think is likely to happen. What they believe and what Matt Hancock made clear is that it's a new variant and it is causing a quicker spread. But there is no indication that it's immune to the new vaccine. They will continue to track and trace as they have been doing. So it won't change what is going on. It's just what the warning is this type of new variant is helping spread the coronavirus much quicker.
Right, Mandy, Christmas is round the corner. How are Londoners feeling about the tough new lockdown? And is the tough Brexit deal at a time of a lockdown proving to be a double whammy?
It doesn't feel like a very festive time of year, that's for sure. And it's very strange. So London going into the most severe level of lockdown, of course, by midnight on Wednesday. But then on the 23rd, all lockdown measures are pretty much lifted for 5 days to allow family members to mix. Now, that has been a raging debate here in the UK because, of course, it doesn't make sense. The government wants to protect that special Christmas time, but there is a real threat that lifting it just for 5 days to allow people to mix for Christmas will cause an enormous spread just when we have the vaccine around the corner. So we might see that change, and Londoners will remain in lockdown. The government is reconsidering their Christmas reprieve. So it is a rather gloomy Christmas time here in London. And of course, Brexit, that lack of movement forward with the deal. So not the happiest time of year.
Right. Trust me, it is the vaccine, which is the only thing that's adding to the Christmas cheer there this year. Thank you so much, Mandy, for bringing in all your inputs on this broadcast today.
Thank you.